North Carolina Free CNA Practice Test with answers 180 questions full review. Question 1. In the event of a fire, what should a nursing assistant do during the rescue phase of the RACE acronym? Option A. Call the fire department immediately. Option B. Move any residents in immediate danger to a safe area. Option C. Close all doors to confine the fire. Option D. Use the fire extinguisher on the flames. The correct answer is option B. Move any residents in immediate danger to a safe area. The first priority in the RACE procedure is to rescue and remove people from the immediate threat of fire. Question 2. What does the letter A stand for in the fire safety acronym RACE? Option A. BAME the nozzle. Option B. The assist the visitors. Option C. Alarm, by pulling the fire alarm and notifying the switchboard. Option D. Apply water to the base of the fire. The correct answer is option C. Alarm, by pulling the fire alarm and notifying the switchboard. The second step is to activate the facility alarm system to alert others of the emergency. Question 3. What does the letter C stand for in the fire safety acronym RACE? Option A. Call the family. Option B. Clear the hallway. Option C. Confine the fire by closing doors and windows. Option D. Check the room for smoke. The correct answer is option C. Confine the fire by closing doors and windows. Closing doors and windows helps slow the spread of fire and smoke throughout the building. Question 4. What does the letter E stand for in the fire safety acronym RACE? Option A. Evacuate everyone. Option B. Extinguish the fire if it is small, or evacuate the area. Option C. Examine the equipment. Option D. Enter the room with a wet towel. The correct answer is option B. Extinguish the fire if it is small, or evacuate the area. The final step involves either putting out a small fire with an extinguisher or clearing the area if it is unsafe. Question 5. When using a fire extinguisher, where should you aim the nozzle according to the PASS acronym? Option A. At the top of the flames. Option B. At the middle of the fire. Option C. At the base of the fire. Option D. Around the edges of the fire. The correct answer is option C. At the base of the fire. Aiming at the base of the fire allows the extinguishing agent to reach the source of the fuel. Question 6. What is the definition of a chemical restraint? Option A. A cleaning spray used in the resident's room. Option B. A drug used for discipline or convenience that is not required to treat medical symptoms. Option C. A medication used to treat a specific infection. Option D. A type of physical exercise. The correct answer is option B. A drug used for discipline or convenience that is not required to treat medical symptoms. Using medications to control behavior rather than treat a medical condition is illegal and considered abuse. Question 7. What is an enabler device in a long-term care setting? Option A. A device that forces a resident to stay in bed. Option B. A device that limits movement but is used to promote independence, like a lap tray for support. Option C. A medication that makes a resident sleepy. Option D. A tool used to help the staff work faster. The correct answer is option B. A device that limits movement but is used to promote independence, like a lap tray for support. Enablers are meant to assist the resident with function, even if they incidentally restrict some movement. Question 8. How often should a nursing assistant check on a resident who is in a physical restraint? Option A. Once every hour. Option B. Every 2 hours. Option C. At least every 15 minutes. Option D. Only when the resident calls. The correct answer is option C. At least every 15 minutes. Frequent monitoring is required to ensure the resident is safe and has proper circulation while restrained. Question 9. How often must a physical restraint be completely released to provide care? Option A. Once per shift. Option B. Every 2 hours. Option C. Once every 4 hours. Option D. Only if the resident asks for it. The correct answer is option B. Every 2 hours. Restraints must be removed every 2 hours to check skin, provide movement, and offer toileting. Question 10. What is the most common and serious risk associated with the use of physical restraints? Option A, increased appetite. Option B, a stiffness in the joints. Option C, strangulation and death. Option D, improvement in sleep. The correct answer is option C, strangulation and death. Improperly applied or monitored restraints can lead to accidental entanglement and lethal results. Question 11. Which organization is responsible for protecting workers from hazards on the job? Option A, the Centers for Disease Control and Prevention. Option B, the Occupational Safety and Health Administration. Option C, the Omnibus Budget Reconciliation Act Committee. Option D, the Department of Health and Human Services. The correct answer is option B, the Occupational Safety and Health Administration. The Occupational Safety and Health Administration sets safety standards to prevent workplace injuries and illnesses. Question 12. What is the definition of contamination in an infection control context? Option A, the process of cleaning a room. Option B, the process of becoming unclean. Option C, the act of washing your hands. Option D, the process of healing a wound. The correct answer is option B, the process of becoming unclean. Contamination occurs when pathogens are introduced to a clean or sterile surface or area. Question 13. What is the most effective way to prevent the spread of healthcare-associated infections? Option A, wearing a face shield at all times. Option B, keeping the residence door closed. Option C, proper and frequent hand washing. Option D, using double gloves for all tasks. The correct answer is option C, proper and frequent hand washing. Hand hygiene is the single most important intervention in breaking the chain of infection. Question 14. Which precautions should be used when providing standard care to all residents? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option D, standard precautions. Standard precautions are the baseline for all care and assume all body fluids are potentially infectious. Question 15. What personal protective equipment is required for contact precautions? Option A, a mask and goggles. Option B, a gown and gloves. Option C, a respirator mask only. Option D, a face shield and cap. The correct answer is option B, a gown and gloves. Contact precautions protect against pathogen spread by direct touch or contact with contaminated surfaces. Question 16. Which type of isolation precaution requires the use of a specialized respirator mask? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option C, airborne precautions. Airborne pathogens are tiny and remain suspended in the air, requiring filtered respirators like the N95. Question 17. What is the correct order for putting on personal protective equipment? Option A, gloves, mask, goggles, gown. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, goggles, gloves, gown, mask. The correct answer is option B, gown, mask, goggles, gloves. The gown is applied first to cover the uniform, and gloves are applied last to overlap the gown cuffs. Question 18. What is the correct order for removing personal protective equipment? Option A, gloves, goggles, mask, gown. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, goggles, gloves, gown, mask. The correct answer is option A, gloves, goggles, mask, gown. Removing the most contaminated item, the gloves, first prevents the spread of pathogens during the removal process. Question 19. What does the term musculoskeletal disorder refer to in healthcare? Option A, a disease of the digestive system. Option B, An injury or disorder of the muscles, nerves, tendons, joints, or cartilage. Option C. A type of mental health condition. Option D. A bacterial infection of the bone. The correct answer is option B. An injury or disorder of the muscles, nerves, tendons, joints, or cartilage. These disorders are common among healthcare workers due to improper lifting and repetitive motions. Question 20. Which bed position involves the head of the bed being elevated to 45 degrees? Option A. A Fowler's position. Option B. Semi-Fowler's position. Option C. High Fowler's position. Option D. Supine position. The correct answer is option A. Fowler's position. Fowler's position at 45 degrees is standard for resting, breathing, and some treatments. Question 21. Which bed position involves the head of the bed being elevated to 30 degrees? Option A. A Fowler's position. Option B. Semi-Fowler's position. Option C. High Fowler's position. Option D. A Trendelenburg's position. The correct answer is option B. Semi-Fowler's position. Semi-Fowler's position is a lower elevation used for comfort and to prevent sliding down in bed. Question 22. Which bed position involves the head of the bed being elevated to 90 degrees? Option A. A Fowler's position. Option B. Semi-Fowler's position. Option C. High Fowler's position. Option D. Sims position. The correct answer is option C. High Fowler's position. High Fowler's is an upright sitting position used primarily during mealtimes to prevent choking. Question 23. How should you lift a heavy object using proper body mechanics? Option A. Keep your knees locked and bend at the waist. Option B. Bend at the knees and squat with a straight back. Option C. Use only your arm and back muscles. Option D. Keep your feet close together. The correct answer is option B. Bend at the knees and squat with a straight back. Using the large muscles in the legs and keeping the back straight protects the spine from injury. Question 24. How often should a resident who is confined to bed be repositioned? Option A. Once every 4 hours. Option B. Every 2 hours. Option C. Once per shift. Option D. Only when they ask to move. The correct answer is option B. Every 2 hours. Turning the resident at least every 2 hours is necessary to maintain skin integrity and prevent sores. Question 25. What is the medical term for the presence of blood in the urine? Option A. Dysuria. Option B. Nocturia. Option C. Polyuria. Option D. Hematuria. The correct answer is option D. Hematuria. Hematuria is an objective sign of potential infection, injury, or disease in the urinary tract. Question 26. What does the term nocturia mean? Option A. Painful urination. Option B. The difficulty starting the urine stream. Option C. Urinating frequently during the night. Option D. Abnormally large amounts of urine. The correct answer is option C. Urinating frequently during the night. Nocturia is common in the elderly and can increase the risk of nighttime falls. Question 27. What is the definition of dysuria? Option A. A frequent urination. Option B. Painful or difficult urination. Option C. Sugar in the urine. Option D. The absence of urine. The correct answer is option B. Painful or difficult urination. Dysuria is often a classic symptom of a urinary tract infection. Question 28. Which term describes the production of abnormally large amounts of urine? Option A. Oliguria. Option B. Polyuria. Option C. Hematuria. Option D. Pyuria. The correct answer is option B. Polyuria. Polyuria can be associated with conditions such as uncontrolled diabetes. Question 29. Which term describes the production of a scant or small amount of urine? Option A. Polyuria. Option B. Hematuria. Option C. Oliguria. Option D. Hanuria. The correct answer is option C. Oliguria. Oliguria can indicate dehydration, kidney dysfunction, or a blockage. Question 30. What type of bedpan is used for a resident who has limited back motion or has had a hip fracture? Option A. A standard bedpan. Option B. A fracture bedpan. Option C. A commode bucket. Option D. A plastic basin. The correct answer is option B. A fracture bedpan. Fracture pans are smaller and flatter, requiring less lifting of the resident's hips. Question 31. What is a colostomy? Option A. A tube inserted through the nose into the stomach. Option B. A surgically created opening between the large intestine and the abdominal wall. Option C. An opening between the small intestine and the abdomen. Option D. A surgery to remove the kidneys. The correct answer is option B. A surgically created opening between the large intestine and the abdominal wall. A colostomy allows for the passage of stool into an external pouch from the large bowel. Question 32. What is the clinical definition of defecation? Option A. Emptying the bladder of urine. Option B. The process of breathing in. Option C. The act of excreting feces from the rectum. Option D. The process of a wound healing. The correct answer is option C. The act of excreting feces from the rectum. Defecation is the final stage of digestion where solid waste is removed from the body. Question 33. What is a fecal impaction? Option A. The normal passage of soft stool. Option B. A severe stomach virus. Option C. The retention and buildup of hard feces in the rectum. Option D. The presence of gas in the intestines. The correct answer is option C. The retention and buildup of hard feces in the rectum. Impaction is a serious condition where stool is stuck and cannot be passed normally. Question 34. Which term refers to excessive gas or air in the stomach and intestines? Option A. Emesis. Option B. Flatus. Option C. Flatulence. Option D. Sputum. The correct answer is option C. Flatulence. Flatulence can cause abdominal discomfort and distension. Question 35. What is an ileostomy? Option A. A surgically created opening between the small intestine and the abdominal wall. Option B. An opening between the large intestine and the abdomen. Option C. A type of heart surgery. Option D. A tube used to drain the bladder. The correct answer is option A. A surgically created opening between the small intestine and the abdominal wall. Because it bypasses the large intestine, the output from an ileostomy is always liquid. Question 36. What is a stoma? Option A. The bag used to collect waste. Option B. The surgically created opening seen through the abdominal wall. Option C. A type of surgical stitch. Option D. A blockage in the throat. The correct answer is option B. The surgically created opening seen through the abdominal wall. The stoma is the portion of the intestine that is visible on the surface of the skin. Question 37. How should a nursing assistant convert o'clock times to military time for afternoon and evening hours? Option A. Subtract 12 hours. Option B. Keep the number the same. Option C. Add 12 hours. Option D. Multiply the number by 2. The correct answer is option C. Add 12 hours. In military time, 1 p.m. becomes 1300 and 10 p.m. becomes 2200.